Hello, everyone. Happy Tuesday. Hope you all are having a beautiful week and hope you had an incredible Memorial Day weekend. My name is Tierney, the founder of The Heart Next Door, and I'm so excited to welcome you all tonight, wherever you're watching from, whether it be LinkedIn or Instagram or Facebook or wherever you're joining us from. Thank you so much for tuning in. Tonight is episode 3 of the Future of Maternal Health Roundtable series, and we are talking tonight about the invisible weight. We're talking about maternal mental health, community support, and a village that heals. We all know that the month of May is filled with so many different celebrations and important things, right? We celebrate mothers at the beginning of the month. We also celebrate midwives. We also, honor and memorialize people who gave their lives for our country, right? But one really big thing that we need to also really pay attention to during this time is maternal mental health, which is one of the things that we just don't talk about enough. Nearly 1 in 5 birthing people experience a maternal mental health condition, and so often they go undiagnosed. But it's not because nobody cares. It's because we haven't built systems that know how to ask the right questions, and we haven't really enlisted our communities to rally around moms the way that they need to hold the answers. And so today and tonight, rather, I have an incredible panel lined up for you guys of experts in maternal health in their own right across community support, across wellness, and across research that are really going to help us dive into what does it look like to support moms. We know that we named this session The Invisible Weight very intentionally because it describes something that we hear over and over again from moms, from birth workers, from public health leaders. And it's the idea that the hardest parts of motherhood are too often the ones that nobody can see. The exhaustion that lives underneath the smile, the loneliness that lives even when you're surrounded by a village, and the weight that doesn't show up on a chart or in a postpartum screening, but we carry it every day. And so today we're going to talk about why are moms still falling through the cracks in a world of people that love them. And we're going to make sure that we do our best together to start building the blueprint to really rally around them in the way that they need to be supported. So without further ado, I am so excited to introduce you to our incredible panelists. Our first is one of our very own maternal changemakers that we honored last year. Her name is Angeline Love Adams. Welcome, Angeline. How are you?
Hi, thank you so much for having me. I'm very well this evening. I'm super excited to be in this space with your beautiful self and our other speakers today.
Awesome. We're so thankful to have you, Angelina. So I'm just going to read your bio for those of you who are not familiar with Angelina, her incredible work. Angeline is a full spectrum doula. She's a lactation supporter, a maternal health equity advocate, and co-owner of Wrapped in Love Doula and Lactation Services. She has dedicated her career to reducing maternal and infant mortality for Black and Brown birthing people in Michigan through culturally rooted care, community breastfeeding support, and birth worker development across the state. Again, welcome, Angeline. We're so thankful to have you. And now I'm going to bring up our next panelist. So excited to welcome all the way from Atlanta. Welcome, Dr. Joy. How are you?
Hello, everyone. Good evening. I'm doing so well. I'm so honored to thank you so much for having me. I'm looking forward to having a great discussion with you all today.
Awesome. Truly the pleasure is ours. So Dr. Joy, for those of you who are not familiar with her work, she holds her Doctorate of Public Health and Maternal and Child Health Policy from UAB and her Master's of Public Health from UCLA. Her work spans Massachusetts, California, Alabama, and even West Africa, and centers on how community, culture, and support systems shape maternal mental health, especially for Black women, immigrant families, and communities of color. Dr. Joy, again, welcome. We are so honored that you're here.
Hey, thank you so much. Thank you, everyone.
Of course. And our final panelist, last but not least, I am so excited to welcome Veronica Brown. How are you, Veronica?
Hi, I'm good, thank you.
Awesome. Veronica is a family nurse practitioner with over 15 years in healthcare, and she is also the owner of the Wellness Lounge in Canton, Michigan. She works across emergency medicine, sexual wellness, women's health, and holistic postpartum care. She holds two master's degrees in nursing and a bachelor's in nutrition, and she brings a conversation that most people are still too afraid to have. So we're so honored and excited to have you. Welcome, welcome, Veronica.
Thank you.
Of course. All right, everybody. So let's get into it. For everybody that's watching, you are more than welcome to drop any questions you have or reflections in the comment section throughout, and we'll make sure we make space for your community voice as we grow. For example, Sarah, we see you. Thank you for joining us from the Womb Holistic Maternal and Family Wellness Center in Canada. It's incredible to see you join us. So thank you for tuning in. And so for our panelists, we're just going to dive in. We already talked about this. There are no wrong answers. We want the raw, unfiltered truth, especially from you. We value your perspective so much, and we are just here to listen and learn and grow together. So without further ado, first we're going to start with Dr. Joy. Dr. Joy, we often use phrases like maternal mental health and community support as if they fully capture what moms are experiencing. But from your perspective, what does the invisible weight of motherhood actually look like in real life? And why is it still so unrecognized?
Yes, thank you. That's a great question. So just starting from it, when we're saying like invisible weight, what does that mean to me? So whenever we're talking about something invisible, we're talking about something we can't see, right? Yeah, and we're talking about something that's unrecognizable, whether that's for ourselves or the people that we love, our family members, our friends, our neighbors, something that we just kind of not necessarily sweep under the rug, but just don't see all the time. And therefore, we're not acting, we're not addressing it. So I think when it comes to invisible weight and motherhood and mental health, one thing I want to point out is the superwoman complex. I don't know if people have heard about that term before.
Let's go ahead and break it down for us, because that.
Yes, of course. Good, good. So superwoman complex. So this title, this term comes from something that we see in a lot of cultures where it's a societal and cultural expectation for women, for mothers, women that become mothers, to just have everything together, right? To be able to navigate being, whether it's a partner, being a wife, being a professional in the workspace, raising your children, being there for your family, being a good friend, like all of the pressures and the expectations that we have navigating. And then when you throw motherhood on top of that, we also just expect that you wing it, that you do it, that you do it by yourself independently, that you don't need the help because you can do it all. You're a superwoman, right? So a lot of it, to me, in my opinion, with invisible weight of motherhood, looks like us internalizing that concept to be a superwoman, to not ask for help. And because of that, we may not recognize when we need help. So there's that part. And the issue with that, the superwoman complex, is that a lot of the times, especially for mothers, it leads to burnout. So when we're talking about maternal mental health, especially in communities of color or immigrant communities, it's not always what we discuss with the generic like depression and anxiety. A lot of the times it's just stress. It's being overwhelmed. It's being worked too hard. It's being tired. It's being exhausted. So a lot of it has to do with us, again, taking on everything, being expected to do a great job with everything, not recognizing help or asking for help. And then that kind of builds within us our stress load. We're burnt out. And then it leads to other health issues down the line, which I'm sure we're going to talk about a little later.
Yes, that is a beautiful way to start, because you could see we're all nodding our heads in agreement because I know we can all agree with, especially the Superwoman complex, not only as, advocates or leaders in maternal health, but also just as women and as moms. That's like very relatable to me. That's something that I struggle with on a daily basis. I have to tell myself it's okay to accept help. It's okay to let people, take the load for you. So thank you so much for lifting that up. And it brings to light another conversation that I had, I remember, with you, Angeline, and we're going to dive into in the next question, but and just about the fact that how all of the stressors that we hold in our bodies as women, when it comes time to give birth, they show up as comorbidities that lead to all these, a lot of these issues that we experience when we are having birth. So thank you so much for bringing that to light. And so the question for you, Angeline, is we know that mothers can be surrounded by people, by programs, and by systems, but still feel so deeply alone. And where do you see the biggest gap in your work between support being available and mothers actually feeling held and supported?
Yeah, thank you for that question. So I think some of the biggest gaps that I see, because you're right, we do on paper have a lot of programs that are supposed to be accessible, but then when you talk to families, that accessibility is not there in the way families need it to be accessible. So we see a lot of programs that have been created from a top level approach by folks who have never had to utilize these resources. And so if we sit down and I talk to the families and I say, hey, there's this program, well, how are the staff talking to them? Are you judging me? Are you talking down to me when I come to try to utilize the service? Do I have to sign over my baby's first year of their life to get access to free diapers? How are we approaching families so that they feel not judged? They're being vulnerable if they're coming to some of these programs, right? And asking for help. And we just talked about how difficult that can be for women in general. And so when we're having programs that aren't truly accessible, then we're just wasting our money instead of having time to connect with families, talk to them about what accessibility really looks like to them, having access to culturally congruent care that is timely as well, and that meets the needs of the people who we're trying to support. So if I need to be able to text somebody, that needs to be a program feature that we have. If I need to get on the phone, if it's 11 p.m. and I need accessibility for that program, we have to start kind of taking a look internally on how we're connecting with families. But I think that's one of the biggest issues is so many of my clients want access to resources, but often they're met at the front door with a negative reaction from folks, and then they don't want to go back. Life is already stressful enough. And especially when we're talking about the load, especially that Black women carry, we already have comorbidities that are 3 times more likely than anybody else. And that has nothing to do with our social economic status, with our education status, and everything to do with that stress that we're carrying in our body. It is difficult to be a Black woman in this society. And when I'm met at the door with more difficulty, it's like, I'll just figure it out on my own. So again, I think it's really just the accessibility that we have. And that's more than just, I can schedule a ride. Sometimes that means, are the people going to look like me? Are they from my community? Do they understand what I've been going through?
Yes, that's so true and so beautiful. And I think you raised such important points, Angeline, that we really just don't think about enough because birth is one of the most vulnerable seasons of our lives that we'll ever experience. And it's really unfortunate when you have a woman or a mom who is literally in such a place of vulnerability, but doesn't have the safety to be able to get the support that she needs. So thank you so much for raising that. And so, Veronica, I want to go to you now. I know that you work in wellness, and I remember you actually sharing a family member's experience with me when we talked earlier. So I want to know specifically, can you share a moment, and you don't have to identify, of course, identifying details, but where a mother's emotional experience made the invisible weight undeniable, and tell us what that revealed to you about where our system falls short.
Yeah, I actually experienced this firsthand with my sister just 3 years ago. My niece will be 3 in July. And this came about just a few weeks after she delivered. She was happy at birth, but then shortly after, she was like completely different. Very sad, depressed, and not wanting to, just feeling so sick that she couldn't care for the baby. So that's where I really stepped in at. And actually, honestly, as a health professional, I had came across many women who experience postpartum, but I don't see them like every day. So seeing that up close and being with her every day was very different than how I would approach my actual patient, because I'm with them just for a small amount of time. But what I found through this process, there are limited resources. And the resources are not just in one area. You have to go through multiple, jump through so many hoops just to get that help. It's going through the primary care provider and them being limited as to, well, I can treat you, start you on some depression meds, but that's really all I can do. But what about the psychosocial? What about the therapy? What about the psychologist? Because hers was very extreme, to the point where she couldn't care for her baby. So luckily she had a partner who, her significant other, who was very active in caring for the baby. So it was the two of us, just, you need someone that's there for the baby and you need someone that's there for the mom. So what can you do for the mom? Hold the baby, allow the mom some time to herself. Sleep deprivation is real. I mean, imagine interrupted sleep. Every 2-3 hours, you got to get up to feed the baby. This is a new mom. She hasn't had that experience. So it was a lot. I mean, when I tell you that we were on a roller coaster driving all across town to get her help, it was a lot.
Wow.
So that is what I found through that process, is that we don't have, it's already limited resources for mental health as it is. But when you are dealing with postpartum depression and you're trying to prevent the mom from hurting the baby, from hurting herself, from hurting others, the resources aren't in one place. We've got to do better with that. And I really feel that we failed the mom postpartum. We've got to start this during prenatal process. At the visit, we're so focused on the fetal heart tones, how is the baby growing? What's the weight of the mom? Is she eating okay? But what are we preparing the mom to what could possibly be after she has the baby? The hormonal shift, what type of support she has. That's important. And so I feel bad for the moms who don't have the support, because not everyone has family. Not everyone will have friends that they can count on. So, I'm happy that I was there for my sister, during that process, because it was rough.
Yes, thank you so much for sharing that. And I echo that completely. Thank God that you were able to be there for her, and you and her husband as well, because again, so many people, so many moms and women don't have support systems like that, which is why, tonight especially, we're elevating the importance of community and why it's so essential. And all of you provide that for moms that you serve in various ways. And I think you also raised a great point too, just about the fact that so much happens between the appointments, right? If we think about the maternal appointments, how many maternity appointments you have, they're so fragmented and so many things happen between those weeks. And that's really when the risk accumulates, right? We know this, especially the emphasis on, being preventative as opposed to reactive, because again, when we look at the data and all the maternal mortality that we see, so much of the deaths happen during that postpartum period, that first 6 to 12 weeks, right? Because that's when, by that time, the risk has already accumulated so much, and mom has to care for herself as well as baby. So you cannot be more accurate. So thank you so much for sharing that personal story. And I want to know, back to you, Dr. Joy. Tell us, we know that maternal mental health is often treated as secondary to physical care, but it shapes everything from outcomes to family stability. In your work and your research, how does it show up as a hidden driver of outcomes that we don't talk about enough?
Okay, great question. So just thinking about mental health as mothers or maternal mental health, when we're thinking about that, we should be thinking about our well-being more holistically, right? So one aspect of our health shouldn't be, on a pedestal and labeled or weighted more seriously or more important than the other, right? So when we're talking about our maternal mental health or our mental health on a more holistic approach of it, we should also be talking about our spiritual health and our physical health and the mental health all having equal weight because it's all connected, right? So going back to like drivers of outcome, that would mean that if one aspect of our health is being negatively affected, so we're showing signs of poor mental health or stress, we're overwhelmed, it starts to spill into those other areas, right, of our spiritual well-being, our physical well-being, and then that in itself becomes drivers of other health outcomes that we see. So when you do have poor mental health, such as like chronic stress, I know we've been talking about stress and being overwhelmed, that really breaks down our bodies, right, both in the short term and the long run. So we go back to thinking of like mental health and having those poor symptoms, and then we're seeing higher rates of anxiety down the line, or PTSD, or depression, or chronic stress down the line. We're seeing like connections now to heart health, to other chronic issues that will come up, diabetes, hypertension. So all of it is connected. So it's really important that when we're talking about maternal health, we put that equal weight on our mental health, our mental well-being, whether we're community members supporting our families, our clients, or we're health professionals or service providers, that we're also paying attention to how these women are feeling and what they're going through mentally and emotionally as well. We're putting equal weight there, because if not, we're dropping the ball, and then that is going to lead itself into a spiel of other health issues down the line for these pregnant and women after they have their children.
Yes, thank you so much for raising that, just the importance of holistic care, right? Like treating us all as whole individuals, mind, body, and soul. And I think that you're so right. That's just so essential, especially not in just in healthcare, but in every facet of life. And so, going back to you, Angelina, and your work in the community, we know that not all support is created equal, right? So, in your opinion, what does real effective support looks like when it actually reduces the emotional burden that a mother is carrying? And why is that kind of support still so rare?
I think that we're getting to better places where we're starting to include more folks in the prenatal education, like Veronica mentioned, because I think one of the biggest cheat codes to making sure somebody has the support they need in the postpartum period is including the partner, whether that's the dad or the grandmother or whoever else is going to be in that space. We can only do so much for the mom at 3 a.m., but the father knows what's been going on. He knows his wife. He knows if something has been changing in her personality, but he may not have the resources or tools to do anything with that information. And if we've continued to kind of push aside his feelings throughout this whole pregnancy, then he just sits with that. And it can also turn into emotional turmoil for him because he has no solve. Men typically want to solve something. So when we pull in the partners during the education piece and we help them understand too what these feelings look like, how they can tackle the emotional load, they probably don't even necessarily know what that is. So for example, I like to have my clients make a list of things that they just need to do, because often we expect our partners to just know these things and sometimes they don't. We have to equip them with success to support us. So I think one of the ways is having more support that's directed to the partner and making sure that they have access to that information. I think everyone should have a doula. I'm a little bit biased on that, but I think everyone should have a doula. I feel like one of my biggest jobs as a doula is to be a community hub, to know what's available in my community, not just know that this resource exists, but who can I hand deliver you to when you need this? I don't have all of, the information, but I know who to find it. And I have developed relationships with people so that I'm not handing you a list. I'm saying, we're going to call Tyranny. She's got your back. She's trusted. I know her. So having that connection, especially translating from pregnancy to postpartum, like you mentioned, we lose so many moms in the postpartum period. And that continuity of care that comes with that doula support can be so pivotal. Some of my moms, they don't want to go back to the hospital, even though they know something is wrong in their body, but they had such a traumatic experience. They don't want to go back there. So now, okay, we're triaging. Where else can we go? You know that something's wrong. Let's find another trusted space to get the care that you need. And then breastfeeding gets a bad rap when we're thinking about mental health. And that's because so often people don't have the support with their breastfeeding journey. They don't have the education. Their partner doesn't have the education. What we know from research is if you have a supported breastfeeding journey, that actually decreases your risk for postpartum depression. So we see those hormones flowing. We see them having better bonding with their baby, but that's when they have that support system. So who is giving you education prenatally? Who do you know you can reach out to once that baby is latching and maybe you're having a difficult day? Who in your community can you connect with? Because we see better outcomes when that breastfeeding is happening. And then food. So nutrition too. We have to make sure that we're eating not just for survival, but we're eating to replenish our body, to replenish our mental health, to replenish everything that our baby is depleting if they're breastfeeding. Sometimes I do a lot of cooking for clients and I like to make nutritional meals, that support the healing journey after you have a baby. But sometimes that's just pulling up with whatever their comfort food is. Sometimes that's just showing up with some food that makes you feel like you are loved and cared for. There's no judgment there. I don't care what your house looks like. I don't care if your kid's ponytail is sideways. Here is a comfort dish made with love just to improve your mood and make you know that there are people who are caring about you. So the last thing I think that's super important is caring for people in the way they need to be cared for. And sometimes people don't know how that is because nobody has ever asked them or no one has ever cared for them in that way. So sometimes that looks like presenting a list of options. These are all of the things that I could do for you. You may not even have known these are things that you could be or ways you could be cared for, but these are the options you have. Because sometimes I'll have moms who they don't want anyone to hold the baby. They want to hold their baby. They want you to wash the dishes. And sometimes we march in the house like, give me that baby, girl, da 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 da. No, she wants that. She wants the rest of this load to disappear. So we have to really provide people with the support that they actually need, not just what we think they need, or else we haven't given them any support at all.
That's so beautiful, Angeline. Thank you so much for lifting that up. And I think another thing I was going to ask you to expound on, just for people who may not know like the full spectrum of support that doulas can provide, or who may not know the difference between doulas and midwives, could you just briefly expound upon that so they know? Because I remember, you even sharing about the fact that a doula can be with you at night. So we know that's one of the most critical periods, right, where moms don't get enough rest. So what are some of the ways that doulas can show up for moms?
Absolutely. So doulas are there to help mom educate herself prenatally, before she has the baby. Doulas provide continuous labor support. So we are there, whether your nurse changes, your doctor changes, your doula is there to kind of help you with the decision-making process, advocacy, evidence-based information, as well as comfort measures during the baby's delivery. And then also postpartum, we can do a variety of different things. So some doulas are coming just to check in on the mom and may do some newborn care, or maybe they're doing some light housework instead so mom can bond with the baby. Maybe they're providing some lactation education, or sometimes it's sibling care. Sometimes a mom is trying to bond with her new baby, but you're feeling that mom guilt because your 3-year-old hasn't went to the park today. So doula support can be a variety of different things, as well as continuing to provide that non-judgmental evidence-based information. And then, as Ms. Veronica talked about, overnight, waking up every 2 to 3 hours, having that sleep that is consistently broken is where we do sometimes see, one, that's challenging across the board, but then that's sometimes where we see people developing psychosis because you're not getting just a long enough stretch of sleep. And it can be super challenging, as well as if you have to go back to work and you have to get up and not get any sleep. So there's also overnight doulas, which is the most magical thing. I wish I knew about them when I had children. And so this doula would come over in the evening. They usually come over around 8 p.m. and they'll stay till 6 or 7 in the morning. If you're breastfeeding, they can bring the baby to you to feed and then take the baby back to its bed. If you want to just say, for tonight, I just want a bottle so I can just simply rest, they're going to follow whatever you would prefer for that situation. They might wash some bottles or fold some laundry over the night, but they're there to make sure that you and your partner can also get that rest that's just uninterrupted. And so this type of support and really true postpartum support is not quite covered under Medicaid yet, which hopefully in the future we can get that support, because full spectrum doula support is, so labor and delivery. And this is really where we see a lot of families who could utilize this support. Most moms who are on Medicaid have to return back to work much earlier than those who are not. And so it would be really amazing to be able to see this as an offering to our families who are under-resourced.
Yes, thank you so much for breaking that down so beautifully. And Veronica, I want to come to you now. We know about the statistics regarding like the inequities that exist in maternal health. And so can you talk to us a little bit about, we know, right, that the invisible weight isn't carried equally across all communities. And so in your experience in wellness and in healthcare, how does inequity show up in maternal health in ways that are lived and felt and not just statistical?
Yes, I think it shows up in many ways, especially when you think of stress, of caring for the baby, lack of support, financial burdens, generational issues, as well as systemic racism in Black women, being that they may not be heard or be seen, be dismissed as to what they're feeling. I don't know if you guys have ever experienced a doctor telling you that, oh, no, you're fine, when you know there's something wrong. You have to be very persistent. You almost have to advocate for yourself in that, in that experience, because if you just go home and say, oh, there's nothing wrong, there may be something wrong, so go to a health provider that will listen. And that is primarily the issue, that no one is listening. So I've seen that. Unfortunately, I've witnessed that, people of color being dismissed, Black women in pregnancy being dismissed of their concerns and their experiences. I'm a strong advocate for everyone that's in my care, whether I'm working in my own business as well as in the hospital and clinic systems. I think it's important, and I feel like that is my job, and I took the oath to provide the best care. But yeah, the support is definitely lacking.
Yes,
for
yes,
sure.
yes, definitely. Thank you. And now to you, Dr. Joy. In your experience and in your research, what conditions or changes actually could help lighten the invisible weight for mothers in a meaningful way, not just on paper, but in real life?
Yeah, so great question. And kind of a lot of what Angeline and Veronica were just talking about too. But let me just give kudos to what's going on here right now and say first, more discussions like this, right? More exposure, more open, heartfelt conversations between the community, between service and health providers, and with these women, with individuals, with families, with their friends, everyone involved, just getting together and having these open-hearted conversations is like one of the first steps. And then secondly, there's so much that you can say here, but when we're talking about the community, at least in the village standpoint, right, with our family, our friends, our partners here, it really looks like just showing up and checking in and being consistent. And I'm getting a lot of this too from a lot of the research that I did. So back when I was in Alabama, I was interviewing pregnant and postpartum women, trying to understand what is their experience with maternal mental health. What is it that you need? And a lot of the times it was just that, was the simple things that we were discussing earlier. It was just seeing what they need. So for example, I'll give you one that just happened recently with Mother's Day. I really wanted to take one of my family members who's a mother for the first time out to a fancy dinner, on Mother's Day. It's her first child, she's by herself doing it all. And I thought, okay, let's go out to a really nice place on me. And she calls me, she goes, hey, I know you want to take me out to eat, but I really need someone to come shop with me. And I was like, oh, okay. Like you're telling me you don't want to go to a dinner, but that was me not listening. That was me not being an active listener and seeing like, this is what is really bothering her. She needs support in these areas. It's not just about holding the baby, but making like these simple everyday tasks easy for her, you know? So she wanted to go to like Whole Foods, TJ Maxx, Target. It was like so much. And you know, I just went on my Google Maps. I found like a TJ Maxx that was right next door to a Target, you know, just trying to make it feasible. I drove, you know, I picked her up, went over there. So it's things like that, just finding specific things that they need. It could be the simplest things, but just being there to lay that hand. So from the community village standpoint, I would say that just checking in, being consistent, seeing the support that they need. Being an active listener, and then also beyond the village and the community as providers, whether we're in service or health providers, it's also advocating for these mothers. It's advocating in ways that when it comes to these policies, the administrative changes we're seeing today, some of the cuts in the resources, that we're also stepping up on our end to extend that voice of mothers at that forefront level. So in my research, a lot of the times when we were talking about maternal mental health, women are talking about paid leave, it not being able to access paid leave because maybe they don't have full-time jobs, they're working part-time, or they haven't been there for 6 months. They're talking about daycare, childcare expenses, not having subsidies. They're talking about the cuts with food and shelter. So us, you know, it's not just as health providers or service providers, but even our community, helping to go to those city town hall meetings, finding information and resources to help support them in those ways. So there's so much that we could do, but I think it just first starts off going back to the woman, the mother, and seeing what it is they need and listening, and then, you know, not just giving information, but taking it a step further to be more actionable there.
Thank you so much, Dr. Joy. And you touched on something so profound in the sense that not just the holistic perspective, but also seeing the different areas of life that we can support moms better. And I know that your research spans across not just various states, but also I know you've done research internationally as well. So I'm curious, have you seen any commonalities or disparities between maternal health issues that we experience here in the United States versus abroad?
Okay, yeah. So most of my global health experience with maternal mental health kind of looks at it more from where do we weigh mental health resources, and kind of like what we were talking about earlier. There was a question that came up about not putting maternal mental health on the top. We kind of gloss over it. And that's an issue that we do see in a lot of other countries, especially in the global south across Africa. Our medical model, our maternal health model is really focused a lot like the delivery aspect and the physical health aspect, but not much resources, not much expertise in the mental health. So there is similarities there. So our discussion for maternal mental health today is not just relevant in this space, but it's beyond the national discussion here in the US and extends globally. So there's a lot, of course, there's differences with cultures and needs, resources in other countries. So not everything is identical, but there are some similarities there where some other countries and communities are also struggling with trying to understand maternal mental health and how to address that and how to integrate that into their healthcare systems and their approach for maternal health.
Thank you so much for sharing that insight. And now, Angelina, I want to bring it back to you. The question is, if maternal mental health is shaped by community structure and not just individual resilience, what would it look like to design systems where communities actively carry the weight with mothers instead of placing it all on them?
Oh, that's a question. I feel like so much of what Dr. Joy just shared, especially around paid parental leave, I think that we're asking something of people that's just not attainable. It's not possible to carry this whole load and be the breadwinner and go back to work and take care of your other children. We joke around often like the grandmothers just aren't grannying anymore. Well, they're at work. They're not available either, because we are in such a terrible place in our society right now where everybody has to work. There's not even as many moms who can just stay at home because their partner can carry the load. So if everyone is working, who is expected to raise these children? Who's expected to support the mom so that she can do both? So I think that the system level approach is, yes, we have to change parental leave. We have to make that accessible. We also have to make childcare not only accessible, but we have to put people in that role who people are going to trust with their babies. So I think that's another challenge too. I'll have some families who get access to public childcare, but they don't trust the people with their children. And so that carries its own mental load too, right? If you're going back to work for a minimum wage job and then you're trusting your baby with someone you don't really trust, now you're really upset. So trying to also think about different ways that community can show up. I think that we have to go back to that village mindset and mentality that we can co-opt with our friends and family. We don't have to put our kid out at 18. We can think about different ways that we can pool our resources and our funds to get through this. As Black people, we're resilient, right? We always make a way out of something. And I think if we start to look back on the ways that we used to do things, we would have more space right now to get through these challenging times that we're in, because we have to start looking at ways that we can pool our resources. We don't want to make that something that you're looking down upon somebody. No, they're using their common sense and making this work right now. If I'm going to work and my sister just had her baby, then she's going to watch these babies and I can support her bills. How can we make this work for ourselves? We do have RX Kids in the state of Michigan that is really making waves, which is super exciting. I think, 9 counties right now and growing. I think that's super amazing. If anyone's not familiar with RX Kids, so it's basically a prescription for money during your pregnancy and 6 months postpartum, and anybody qualifies. You just have to live in the specific county. And so we've already seen an increase in support for families, whether that's they're able to buy diapers, food, gas to get to their appointments, childcare, but there's no rules and stipulations for that funds. And I think that's another thing that we do a terrible job at, is giving people autonomy to make choices for themselves for what they need. And so RX Kids does a really great job of that too.
Yes, thank you so much for lifting that up. I know in Detroit specifically, when it was brought, into effect by the new mayor, Sheffield, that was such an exciting thing, right? Because that's a beautiful signal of, I think that you can tell how much a community cares about its people and its families by how they treat, moms, because we are at the heart of it all. So thank you for lifting that up. And also just the fact about just the general concept of it taking a village and us getting back to the basics of that. I think it's so interesting that we are a society that's so much, we have access to anybody in the world really at our fingertips through technology, and yet we're so isolated and so lonely in our day-to-day lives. And so I can't emphasize enough the importance of that village mindset. Thank you, thank you. And so now I want to bring it to you, Veronica. We know that reflection alone isn't enough, right? We can talk about it all day, but what is one specific action that you believe individuals, communities, or systems should take immediately to change how mothers are emotionally supported?
I feel like listening is number one. I feel like once the mom feels that she has been seen and heard, that's going to be the first step to building trust, because then she can open up and really tell us how she's feeling and what she's really been going through, her thoughts and everything. So really tapping into that emotional side, asking the mom, how are you doing? I mean, think about how many times you've, met up with a girlfriend, or you've been at work and you ask a coworker, how are you doing today? It's kind of one of those things that we do and then we just walk away. But we need to be more intentional as to how are you doing? What's going on with you? How are you sleeping? Are you eating okay? That type of thing. Because then we're being intentional about how that mom, we're validating how she's feeling, how she's really feeling. because so many people are focused on the cuteness of the baby and what the baby is doing, but we're not checking in with mom enough. So I think if we can reach them more emotionally, then we can start by building a better community and supportive group for them.
Yes, that is so beautiful and so true. Everybody, as soon as baby comes, it's almost all about baby, right? Everybody's like, and mom, yeah, everybody wants to hold baby and check on baby, but we have to make sure that mom's good too. You know, even mom, I think, so easy to become so consumed with baby that you forget about taking care of yourself. But I know I personally had to remind myself that you can't pour from an empty cup, especially like when I was breastfeeding, right? If I don't eat and take care of myself, I won't have any nourishment to give my baby. So it works twofold. So thank you for lifting that up. And as we come to our final couple of questions, I just again want to invite the audience, if you have any question that you want to raise to our panelists before we close, please feel free to drop it in the chat. We love to see your engagement and we love to connect with you all because this is a conversation that involves all of us. And so now this question, I'm going to give everybody an opportunity to answer it. And this is really like a personal question, right? So there may be a mom who's listening right now, and she may be surrounded by support, but still carrying the invisible weight all alone. What truth do you want her to hear most right now? And for everyone else, what responsibility are we no longer willing to ignore when it comes to how mothers are held within our sphere of influence? I'm going to start with you, Dr. Joy.
Okay, this is such a great question. I know I say that for every question, but they've all been great. So yeah, a truth for mothers to hear right now. Yes. So I'll go back to when I first started with like talking about that superwoman complex. And we see it in so many cultures, not just Black, African American, but communities of color here in the US, immigrant populations. Excuse me. So I will say what I want everyone to hear about that is that as a mother, if you do need support, that does not make you weak. It does not mean you're weak. It does not mean that you're failing. It does not mean that you're not being a good mother because you can't do it all. It just means that you simply need support, and as everyday people, whether you're a mother, you're a teacher, you're a student, we all need support sometimes, and it's okay. So just kind of learning how to, it's a process of changing that mindset, but just to know that there's nothing wrong with asking for help, for one. And then kind of tied to that, rest. It's really important that we rest. I know mothers are doing it all. You are a lot of the times working. You might be in school trying to better your education, your skill sets, taking care of other family members. But even with all of that being done, you still need to carve out time for yourself to rest. So rest doesn't always just mean sleeping. I know that's a little hard. Sleeping is important. It's important to get your 8 hours, but of course, with a baby, your time is also connected to their time. But rest also means self-care, right? And I think you were mentioning it as well when you were talking about yourself, Taryn, about your self-care. And self-care doesn't just mean like turning off your phones and secluding and isolating yourself. It's just taking care of yourself in every aspect. So when we're talking about holistic well-being, we're talking about making sure you feel fulfilled socially, romantic relationships, your family relationships, spiritually. A lot of our communities are spiritual, so feeding yourself spiritually, however that looks like for you, physical well-being. So if you enjoy going out for walks, dancing, if you enjoy other extracurricular activities, that helps. With art expression, doing that, like carving out time to get back to yourself as well, outside of just being a mom and your other responsibilities, pouring into yourself and helping to re-energize that depletion that you may be feeling.
Yes, thank you so much. I remember somebody told me once that self-care may feel selfish, but it's not, right? It's selfless and it's really important. So thank you for lifting that up. And I also see in the chat on LinkedIn, Sarah says that asking for help is a form of strength, right? So I think it's important to lift that up as well. And so now, same question for you, Angeline.
So I would want any mom who's watching or hearing this to know that you are seen, you are heard, you are validated in that experience, and you are loved. It can be super hard to ask for that help, but also sometimes we have to ask for that help outside of our house because the people in our house don't know yet how to answer that for us. So sometimes that can look like different like mom groups that are in your community with folks who are in similar situations like you. I lift up a couple that are in the Detroit metro area. Hythe Healing House, an amazing resource in Detroit. Our Village is an amazing resource in the Washtenaw County area. Wrapped in Love has different things as well. But also that some days you're just an okay mom. We put a lot of pressure on ourselves to be great all the time, and our kids don't even realize any of that. You can just feel like you did the absolute worst. And sometimes you lay down with your kids and you say, how was today? And they just pour back into you, even when you don't feel like you did your best. And communicating with them too, we put a lot of pressure on ourselves again with our kids. Sometimes I just have to tell my kids, I'm only human. We get in this position where we feel like we have to be so strong for them also, but we're also raising them not to understand their emotions and do self-care for themselves. So maybe that looks like, what are we all doing for self-care? Mommy's going to find her self-care in that moment. What are you going to find in that moment too? Maybe it is, I'm taking a bath. Mommy is human. I've had a long day. I need some space right now. I'm going to shut the door. Unless the house is on fire, everybody leave me alone. So really communicating with your kids too, what you need. You're a person as well. And sometimes we are afraid to share our emotions with them. But sometimes we have to just sit down and be honest with them. That can sometimes save, a lot of yelling and things like that, because we're just saying how we feel and we're teaching them to understand and respect people's emotions. So that's my little nugget.
Yes, beautiful. I love that, being vulnerable and honest with your kids. Thank you so much. And so, Veronica, tell us, what do you think?
Yeah, so I feel like there's a lot of pressure for moms to be strong and to carry the burdens. But whatever, we're all women. And I feel like we're just delicate flowers and we're allowed to live in that soft era, so you don't have to be strong for everybody. And if you're pouring into everyone else, then you have nothing left to yourself. So it's okay for you to take time out for yourself. It's okay for you to ask for help. It's okay for you to need the support of your community, whether it be your friends, your church, your family, your workplace, wherever you find comfort in your safe zone, it's okay. You are human and we're not perfect. That's it.
Yes, 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 yes. And Sarah says too here in the chat, she says, it's okay to also do nothing, right? It's okay to rest. It's okay to just be. So thank you so much for normalizing that, because I don't know where that came from. I don't know how we all just woke up one day with superwoman syndrome and we just want to take on the world. But it is okay to rest and to be soft. And I think that also makes us better moms, better women, better at everything when we're able to really take care of ourselves. So thank you, thank you, thank you. Wow, what an incredible panel you all have been. And before we start to wrap up, one thing that I always like to ask people, I'm also going to give you guys a chance to go around one by one and share if there's anything specific that you're excited about that's coming up within your community that you want to share through your companies or your different ventures. And then also just tell people where they can connect with you. We'll start with you, Dr. Joy.
Okay, so yes, so I graduated my program last year. So with my thank you, with my public health degree, I'm all about practice and going back into the community, taking the research that we've learned and seeing how we can really translate that back to helping you all. So something that I'm trying to do now in the maternal mental health space is create kind of a model to help out mothers with how self-care can look like for them. So I know we've been discussing self-care a lot. There's already a lot of self-care resources, but how that can look like for us within our communities, our cultural, that's culturally relevant to us. So like when we're talking about self-care, expanding that self-care to be more holistic and including parts of our culture that may not be discussed. So I'm really looking into that. I'm going to be hopefully launching something towards the end of the year. I'm always happy to connect with people on LinkedIn. So I think you're sharing this as well, but it's my full name. I can put it in the chat and via my email, which is my name, Joy, Joy, Ima, IMA, altogether, .drph@outlook.com. And then on LinkedIn, I'm Joy Selena Amathodon. It's my full name. I'm always happy to connect and speak with other groups as well. So thank you all for having me.
Awesome, awesome. We're honored to have you. And Angeline, go ahead and tell us, is there anything exciting coming up that you guys are offering? And how can people connect with you?
Yeah, so we provide quite a few free educational classes in the community. So we provide a childbirth basics class, a breastfeeding basics class, a class just what is a doula, how you can get connected with us. We have a Dads as Doula program as well. And we do Booby Club, which is a monthly drop-in session to get lactation support, but also just to connect with other moms. We do most of our classes in Washtenaw County, and really trying to make it more accessible to families. So our classes are only an hour and a half. That way folks can come when they need it versus longer classes that may not work for other people. We have a fatherhood barbecue and kickback coming up June 14th. We would love to see everybody there. This is going to be a celebration of fathers. We're going to have lots of different resources for men, from mental health to custody, all types of resources, but there'll be bounce houses and all types of things. And then in August, we have our 4th annual Community Birth and Beyond Resource Fair. We're doing it even bigger and better this year. This is a free event for the whole entire family. It's to uplift joy, to celebrate Black breastfeeding, to celebrate families. We'll have photographers, bounce houses, tons of resources and giveaways. And all you have to do is show up to be supported, loved on, and cared for. You can find out about all of our classes and events that we're hosting. Facebook, we're under Wrapped in Love Doula and Lactation Support. And on Instagram, we're Wrapped in Love Doula.
Awesome. Wow, some exciting events you guys have coming up. Especially, I love the Booby Club. That's awesome. I wish I would have known about that before. Okay, now, last but not least, Veronica, let us know what you guys have coming up and how people can connect with you.
Yeah, so I'm in the process of creating a safe space for moms to connect with me, whether it be me giving them resources on where they can better help themselves or just being an outlet for them to just talk to someone. I do want to say that my sister did come out on the other side and she's doing very well now. She just completed her PhD. She did all of this while doing that. And I will share the dissertation with you because it was similar to what we kind of discussed today. So it was all related to hear about her real life story and all of that. And all the women that she connected with as well. I can be found on Instagram at TWL by V Brown. And on TikTok, I am under the Wellness Lounge. And I hope I can connect with you all. I enjoy speaking. I treat both men and women, but I do a lot of women's health. So reach out, let's connect.
Awesome. Wow. Well, so happy and just really in awe that your sister, has, 3 years later has a dissertation as well. That just is so beautiful that she was able to take that experience and create something to really help others. So we honor her. Thank you so much for sharing that. And as we sign off, we just have one custom that we usually do. So every time we sign off on one of these episodes, we always ask you to finish the sentence. And so the sentence starts with "the future of maternal health is," and you can just Finish it with one word if possible. And we're going to go around, starting with, you guys need time to think? Or are you ready? Okay, ready? All right, Veronica looks like she's really ready. Okay, Veronica, the future of maternal health is
mandatory.
I love that so much. Yes. All right, Angeline.
The future of maternal health is client-centered care. Sorry, that was more than one word.
Oh, we
True
got it.
client-centered care.
You're right. It was great. We got it. Yes, 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 definitely. And Dr. Joy, the future of maternal health is
It's probably not one word either, but the future of maternal mental health is for our community.
Yes, 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 yes. Beautiful, beautiful. Wow. Well, it has truly been an honor, hearing all of your expertise. We're just so grateful to have you. So grateful to everyone who is listening and tuning in. I see some interactions too. Somebody says the future of maternal health is culturally responsive. So yes, that is so true. And that is what we're building together, right? And it comes from conversations like this, collaboration like this. So thank you guys so much for tuning in. If you are interested in learning more about the Heart Next Door, please, you can access our free app if you are a new or expecting mom. It's on the App Store, and it's meant to put care and community at the fingertips of new and expecting moms while equipping the providers that serve them with the data needed to intervene and improve maternal health outcomes. You can also visit our website if you're interested in joining our maternal change maker community, if you are a leader. And if you are interested, I know you guys will be here. Join us the same time next month. We'll have a panel. It's going to be really exciting. We're bringing the men into the conversation in honor of Father's Day. So we hope to see you all there. And in the meantime, enjoy the rest of your evening and have a beautiful week. Thank you so much for joining us. Bye.